Pain, you've heard me say this before, pain is incredibly complex, and not always described by imaging. Images are still shots of what's happening inside the body. Oftentimes, pain is associated with movement. The next idea I want to introduce here is that movement is medicine. People, and even physical therapists, very often try to use anatomy to explain someone's pain. No matter how hard I've tried, my brain has never worked that way. Everybody wants a diagnosis of what structure is wrong or causing the issue, but pain is so complex. There is the anatomical piece for sure, but there's also a training, workload, prolonged postures or activities, strength balance discrepancies, stress, or biopsychosocial factors that influence pain. All of it contributes to one person's picture. So trying to explain it with one anatomical structure just kind of falls short in my opinion. Instead, I like to explain and treat these things with movement. So for example, going back to the low back, there isn't always a specific mechanism, but the treatment is to find the movements that are problematic and then reintroduce those movements in a specific way, educate and guide the person through what is appropriate pain response until they're able to desensitize that movement until it's no longer an issue. Then I integrate some load or resistance, again, in a specific manner to avoid these big spikes in activity that people decide to do once they're out of pain. And then just guide the appropriate progression and help make training or activity decisions from there. It is not a quick fix, but it is effective for the way that the nervous system and the body as a whole prefers to adapt. It's using movement as medicine. Now, I will say, when I first started out as a PT, the cases that still haunt me are because I had the mindset that every problem could be solved with movement and PT. And maybe those cases could have, but I was too novice then to appropriately manage them. But at bare minimum, what I tell people, and I believe a lot of PTs are telling people, is to try conservative treatment first. At least we get a shot to improve something before making a decision that we can't undo. You can't undo cutting someone open and trying to repair something. So many times people just want the surgery because they just want it fixed. And unfortunately, I saw a number of cases where someone was having hip pain. They went and had hip surgery because MRI showed something. They get over their initial post-op pain and the issue persists because the issue was actually from their back. So they spent all the time and money and can't undo the hip surgery that they've had. I'm not saying surgery is never warranted, but you should at least try to get a quality PT first and give it a shot. If it doesn't work, at least you know you were thorough and didn't jump right to surgery.